Good afternoon, everyone. Thank you for taking some time this afternoon to meet with us and learn about the ways to unlock the secret to accelerating patient payments. My name is Tony Peterson, and I am the VP of Business Development and Customer Success here at NextTrust. I will be taking you through today's presentation. We would ask that you hold all questions until the end of the presentation, at which point we will open it up and allow you to ask any questions that you might have. So as we go into today's presentation, one of the first questions that we need to ask ourselves is whether healthcare functions more like a B2B or B2C business. Business to business, or B2B, is a transaction or business conducted between one business and another, such as a wholesaler and a retailer. So if your practice, for example, were to purchase supplies or software or solutions from somebody, that would be a business to business transaction. B2C refers to business to consumer, which is the process of selling to the end user, or the no middle person in between. You're selling to the person that is ultimately consuming the good or service that you're providing. And healthcare traditionally has been designed around the B2B or business to business mode of functioning. That is because the majority of healthcare historically has been paid for by insurance carriers. So in many ways, the customer of our businesses has been the insurance plans or the insurers that are paying for the majority, or historically paid for the majority of the care that has been provided to patients. And that has been changing over the last 10, 15 years. If we take a look at the shifting landscape over the last couple of decades, patient obligation now accounts for more than 50% of the healthcare dollar spent. 1 in 20 Google searches is now for health-related information. That is across all of Google. Patients are looking for health-related information. 72% of all internet users go online to look for health information. If you go think about something weird pops up, or you show a symptom, the first place that most people go is to Google to try to figure out, I'm going to self-diagnose myself and figure out what's going on. 35% of adults do that. They go online to figure out their medical condition. Cost of care and travel time together comprise more than 70% of a consumer's choice when selecting medical providers. So what that means is they want to know that their provider is close to them and that they're going to be able to afford the care that is provided by their healthcare provider. And as the patient's financial responsibility rises, the likelihood of collecting those patient payments in a timely manner significantly decreases, making it imperative that you have efficient billing and payment processes that those consumers or those patients can utilize. So today we're going to be talking about overcoming the 6 most common objections that patients have to paying their medical bills. Now, these are the objections that the patients are going to say. You're going to see with some of them, they may be legitimate objections. Some of them are reasons or excuses that a patient might give you that they're not going to pay their medical bill. But either way, we have to adjust and adapt to what the patients are saying. So what are those 6 most common patient payment objections? The first one is the patient saying, my preferred patient payment options are not offered. I want to pay online and you're only allowing me to pay in person. I prefer to use my corporate Amex or my rewards Amex, and you don't offer Amex payments at your practice. If we don't allow patients to pay the way that they want to pay, it decreases the likelihood that they're going to pay. Number 2, medical bills are not a priority. This is something that we run into quite often. It's not that the patients necessarily say it up front, but this is the way that their behavior reflects their objections and their priorities. The third one is very, very prevalent. Patients are confused about what they owe. The healthcare system and the way that it's paid for is not a very straightforward system within the United States, and it leads to confusion from patients as to what it is that they should be paying. And so it's important that we find ways to solve that. The fourth objection is that they don't know where to pay. I don't know where to pay my bill. The fifth one, which could very easily be listed as number one if these were in order of most often cited, is I can't afford to pay that much. Healthcare bills do consume a large portion of the average family's budget, and if they can't afford to pay their bill, it means that they're much less likely to do so. And the last one is that if they say, I didn't know that I received a bill. Now, like I said, some of those may be more legitimate, other ones may be less legitimate, but I'm sure that you're going to find a large portion of the patients that give you an objection will fall within those 6 categories. So really, if we're trying to solve the problem, which is the objections that the patients give to paying their bills, it's critical that we address the root cause of the issue. What is the real reason that the patient is not going to pay? If we take a look at the diagram here, the problem is above the surface and obvious with the weed that is growing there. I've sent my kids out to weed our front yard many, many times, and often they'll just pull off the top of the weed, leaving the root there. In reality, the root is the source of the problem. If you just pull off that top leafy part of the weed and leave the root in place, the weed is going to grow right back. So if we really want to solve the problem that the patients have with why they're not making their payments, we need to acquire the right tools necessary to address and fix their concern. Or in other words, we need to pull out the weed with the root. We need to make sure that we know what the contributing factors, the underlying issues are that are causing them to not want to pay their bills. And then finally, we need to show results. So let's go through the 6 different reasons that patients give for not paying their bills. The first one, my preferred payment options aren't offered. I would, but I can't because I didn't know. This is why. You're not letting me pay the way that I want to pay. We've got some stats here that come from the paymentsjournal.com. The link is down there on the bottom of the screen if you'd like to go source that and see where this data comes from. 13% of all consumers pay their bills in person. That's a really interesting stat. If you think about that, that means 87% of consumers are not paying their bill while they're in person. How does that relate to your practice? Where do the majority of your payments come in? If you are like many of those practices out there, a large portion of your payments are being made in person. But that means that you're using a methodology that is different than the consumers use to pay the rest of their bills. 60% of all consumers are currently using an automatic payment method. 90% of installment payments with online brands were made using debit cards. So that's where, like Amazon lets you break up a payment into 3 or 6 payments. Patients are going and making those payments online in installments using their debit cards. 90% of them. That's a huge number. 44% of people have an automatic deduction coming out of their checking account right now. Do 44% of your patients pay their healthcare bills automatically? The answer is probably no. 38% of all consumers have an automatic charge set up for a credit or a debit card. 60% of consumers use digital payment methods. We're looking at things like Apple Pay or Google Pay. 39% of all consumers use a biller's website or mobile service to pay bills. 28% of consumers use their bank's website or mobile app. 27% of consumers pay their bills by mail, and 93% of all healthcare consumers would pay their bill online if given the option. So if you take a look at those numbers and then compare it to where your revenue is coming in, is more than 13% of your revenue coming in person? If so, you are not meeting these patients where they like to pay their bills. If you don't meet them where they like to pay their bills, they're far less likely to actually do so. So what is the solution to this? You as a business need to expand your payment options to include all of the different methods and contact types that the patients would be demanding in order to pay their obligation. That means that you need to take not only cash, check, and credit cards in the office, but you need to explore automatic payments. Patients are willing to sign up for automated payments. There are solutions out there, and Bill Flash offers them that allow you to do so. Online payments. Are you providing the ability for your patients to collect online or to pay online, to see their bill and meet their obligation from the comfort of their home or from their mobile device? Are you offering payment plans to those patients who have a larger obligation that allow them to more effectively manage their cash flow within their family? Are you giving them the option to store payment methods so that it's easy for your staff to give them a call and say, would you like to pay your obligation with the card that's stored on file? Are you offering mobile payment options where they can use their phones to pay their bills? Are you offering them the ability to utilize text messaging, which is where the large majority of interpersonal communication has moved? If you are not offering a wide range of these payment options, you are giving the patients a reason to not pay their bill. Now, whether they could take that or not is a completely different question. Whether they will decide not to pay their bills or whether they will decide to pay their bills will be strongly influenced by the decisions and the offerings that you make here. Let's move on to objection number 2. I can't afford to pay that much. How often have you heard from a patient that they don't have the money to pay the obligation that you have sent to them? It's something that happens all the time in healthcare. Nearly 20% of all patients get sent to collections. On average, medical bills that are sent to collections range from $750 to $2,600 per person. That's a fair amount of money. But if we take a look at the other types of items that are sent to collections, the balances are relatively small in healthcare relative to some of the other options that are there. Take a look at automotive. It's almost $6,000 in outstanding debt that is sent to collections in the automotive industry. Education, almost $3,000. We're sitting here on average at $750 to $2,600. So while it is a large amount of money, there are other things that might be a bigger bill for those patients. Approximately half of all consumers that have medical collection debt show no other evidence of financial distress. That means they're just choosing not to pay their medical bills. So what is the solution to that? Up front, you should be providing good faith estimates of the financial responsibility prior to seeing the patient whenever possible. If they understand what their obligation is going to be before they make the decision to consume that care, they will understand and make better decisions about how and when to pay for that care. You need to identify those concerns that the patients might have and establish automated payment plans before they are seen. If you wait until after the patient has provided the care or has been provided the care by your practice, they are going to have far lower likelihood of paying. You have given up the leverage that you have, which is that the patient needs something from you. The patient needs to be seen. They need the care that you're going to provide. If you wait until after that care has already been provided before you ask them to get on a payment plan, it's going to be far less likely that they're going to comply with that. And finally, you should offer them discount options if they pay in full. If you get those patients to pay upfront prior to the visit, give them a financial incentive to do so. If you take these steps, you can mitigate the risk that comes from a patient saying, I can't afford to pay that much for my care. The third objection that we talked about is, I'm confused about what I owe. This is something where I don't believe that this is hyperbole, or that the patients really aren't confused. Medical billing in the United States is very, very difficult, as we all know. There is a large knowledge gap in healthcare coverage literacy. In fact, only 12% of all adults had proficient health literacy. 53% of them had an intermediate level of literacy, and 22% had basic level. 14% of all people lack even basic understanding of health literacy when it comes to the understanding of their insurance coverage and their health care coverage. 3/4 of Americans ages 22 to 64 report that they know how to use health insurance. Yet only 1/5 of those could calculate the cost of a routine doctor's visit. Only 16% of healthcare consumers were able to calculate what they would owe for out-of-network lab tests with a capped allowable charge. Patients don't understand what it is that they're being asked to pay. And if they don't understand it and we're asking them after the visit, it's going to make it far less likely that they're going to pay. 21% of healthcare consumers did not understand that a health insurance premium is paid monthly, and only 28% of healthcare consumers identified the correct definition of the word deductible. It's wild how big the gap is in understanding how to pay for healthcare in the United States. When the patient is confused, they're far less likely to pay. That results in payment delay or abandonment. 39% of employees have a full understanding of their health insurance policy. It takes 18 minutes on average for employees to spend enrolling in their benefits. 19% of employees did not feel confident that they understood everything they signed up for after their most recent benefits enrollment. 93% of employees chose the same benefits each year rather than making changes during open enrollment periods. 56% of employees spent less than half an hour researching their benefits options during the last enrollment, including 19% who didn't do any research at all. 52% of employees say they understand their health benefits, and 43% indicate that they understand their non-health benefits very or extremely well. 35% of employees either know nothing about or don't understand their healthcare coverage, while another 33% don't understand their medical bills. This is a large amount of confusion, and if there is confusion, it will inevitably lead to payment delays or abandonments. So what is the solution? You need to communicate the patient responsibility and determine the payment schedule in advance of seeing the patient. They need to understand, this is how much I am going to owe for the care that I'm about to consume before they make the decision to consume that care. If they don't do so, they're going to, in many circumstances, simply abandon the responsibility once the care has already been received. We need to ensure that we're providing clear and consistent amounts in the billings that we're sending to them. They need to understand what are the amounts that they owe versus what was brought in from the insurance payments. We also need to make sure that we're communicating with them across all the different billing methods so that they see the amounts that they owe prior to the choice that they make to consume the care. So that means we need to send them mail, text, emails, phone, talk to them, in-person discussions as they're sitting in the waiting room. They need to understand what they owe prior to the decision that they make to consume care. The fourth objection that patients have is simply that medical bills are not a priority. This means they just don't want to pay it. That is a real tough thing to hear when you're in the business of providing that care, but it is the reality that is out there. We take a look at a survey that was done by McKinsey back in 2009. These are the percent of customers ranking the following expenses in their top two choices in terms of where they prioritize it. The first thing that people pay is their mortgage or rent. The second thing is their utilities. The third is the health insurance premium. That doesn't go to you. That goes to the insurance carrier. Fourth is credit card bills. Fifth is the auto loan or lease. Sixth is the cable, cell phone, and internet. And way down in seventh place are the medical bills that come after the care has been provided. The only two categories below that are other, and they only account for 3% of the responses, and entertainment or discretionary fund spending. Out of the required bills, the medical bills fall by far lowest on the prioritization totem pole that these patients have. So, how do we make sure that they understand, and how do we get that up to a higher priority for them? First, we need to utilize automatic payments. If these patients know ahead of time, they're provided an option to enroll with an automated payment before they choose to consume the care, it's going to be far more likely that that payment is made. We need to allow payment plans when necessary, again, collecting before the appointment whenever possible. And we need to transition our billing communications from a B2B approach to a B2C approach. We need to communicate firm payment expectations at the time or prior to the service, and we need to communicate the consequences for non-payment, accrued interest, being sent to collections. What are you going to do if they don't pay their bill? If the answer is nothing, then why would we be surprised that some patients make that choice to not pay their bills? If the consequences are communicated to them and made sure that they're aware of that prior to deciding to consume the care, they can make a more informed decision, which means that you're more likely to get paid. The fifth objection was that I didn't know that I received a bill. Let's take a look at how patients prefer to receive their invoices, by mail or electronic. If we look at this and say, all right, medical bills, 74% of patients have said, I prefer to receive my medical bills by mail. Only 22% said they prefer to receive them electronically. Now, this is an interesting stat that is here. If you take a look at that number, it is by far the highest number on this list. The mortgage payments, only 44% of people want to receive their mortgage invoice by mail. Half of people want the internet invoice. We're talking a good 25% higher to get up to medical bills. Why do patients want to receive their medical bills by mail? Well, it's not because they're looking forward to paying them by mail. The reason they want to receive those invoices by mail is because they want to have the delay in paying them. When mail is sent out, they have to wait for the bill to show up, then they have to wait for the payment to go back, so that gives them time. That's the reason that they want to receive those bills exclusively by mail. If you are providing them different options and they're made aware of their obligation earlier or closer to the point in time where the service was consumed, they're going to have that awareness, and the clock on the payment is going to start far sooner. The patients don't prefer that because they don't want to pay it sooner. But if you provide that sooner, you want to do that because it will begin the process of making sure that that payment is made. Millennials check their smartphones over 150 times a day on average. There's 24 hours in a day. Think about what that means. We're talking between 6 and 10 times an hour that millennials are checking their smartphones. They also make up the majority of workers in the workforce right now. Sending electronic statements in addition to paper typically cuts the average days for these patients to pay from 20 days to 9 and boosts the percentage of full payments rendered from 77% to 95%. The link for this data is at the bottom of the page, so when we sent out the PowerPoint, you'll be able to see that and read up on it. But imagine if somebody said, we can reduce the time that it takes for your patients to pay you by more than half, or we can greatly increase by almost 20% the number of patients that are paying their bills in full. That's something that most practices should want to see, because that's going to increase your cash flow and ensure the financial viability of your business. So what's the solution? Make sure that you're notifying your patients of their financial obligation through all of the available billing methods. You should still send them their statement in the mail. That is one of the best ways of ensuring that the obligation is met in a legally binding way. But in addition to sending them that mailed statement, you should be sending them email notifications of their responsibility. You should be texting them, letting them know what their responsibility is. And in addition to that, we can make phone calls and have conversations with them. We could also add in-person conversations with them as they're waiting in the waiting room. The next, and I believe getting closer to the end of the list of objections here, I don't know where to pay my bill. If you receive a bill by mail, do you prefer to pay it online or by mail? The survey that we have done here, that we've listed here, says if I receive a bill by mail in my mailbox, 55% of all people want to pay that mailed bill or statement online. Only 33% of those people who received that bill by mail want to pay it by mail. There's a good 7% that say their bills are on auto pay and they're not thinking about it, and another 3+% that were not able to be categorized in that. Are you, as a practice, allowing your patients to pay their obligations online? If not, you're giving up on revenue from that group of people who are receiving those mailed statements and still not being provided the way to pay it the way they want, so they're less likely to do so. So what are those solutions that we would use to meet this obligation and solve it? You need to offer and communicate multiple payment options through all billing channels and in your office. So, are you offering cash, check, credit cards like we talked about before? Does your practice allow PayPal or Venmo type payments? Are you accepting Apple and Google Pay? Do you give them the ability to set up automated payments through bill flash payment services? Are you giving them the ability to do online payments? Are you offering payment plans? Are you letting them store their payment methods or taking payments over the phone or by text? If any of these things are lagging, then you are not meeting the patients where they pay the rest of their bills. If they're paying all of their bills on their phone and they can't pay your bill on their phone, which bill's going to be the last bill that is paid? It's going to be yours. So it's critical that we are offering them the solutions where they're already paying their other bills, because then they're going to be removing the excuse, I don't know where to pay. Bill Flash is your end-to-end financial solution to solve the concerns that we've talked about here this afternoon. Bill Flash allows you to communicate financial obligations, and getting paid really has never been easier than if you're utilizing the all-in-one Bill Flash solution. We offer you the ability to provide online pre-visit payments to patients so you can communicate their obligation and allow them to pay it before they're seen. We allow you to have integrated in-office payments that can communicate back to your EHR or practice management system. We offer the ability to send out text and email notices of their financial obligation, so they're able to see what they owe and very easily click a link to pay that, which is the next offering there, the online post-visit payments. The text and email notices can go out, and then they click a link and are able to make that payment immediately. We also offer stored and automated payment plans, which allow those patients to very easily meet those obligations, and offers you the flexibility to provide options to somebody who might be in financial distress. All of these solutions are offered under one roof. If you look at it, we offer billing, payment, integrated collections, and with our resellers that work with us, we can offer RCM solutions to you that will help you obtain the revenue that you need by meeting the different concerns that we talked about here today. All of these different services work seamlessly together to streamline your vendors into one single application. We offer you a unified reporting platform which will provide complete visibility into the financial health of your practice on the patient obligation side of the Let's talk about the print and mail billing offering from NextTrust Bill Flash. When you send your mailed statements using an offering like Bill Flash, you save more than 65% versus sending those statements out by printing them out in-house, stuffing the envelopes yourself, stamping them, labeling them, taking them to the post office, getting them off. 65% cheaper to do that using the Bill Flash print and mail offering. Print and mail statements are still the most reliable way to send a legal notice of financial responsibility. We offer you customizable templates, easy ability to review, edit, and approve, fast delivery. When you send those statements using Bill Flash, they are mailed out the next business day. We offer automatic address updating using the NCOA from the USPS. What that is the National Change of Address, where if the post office knows that somebody has moved from one address to the other and you send a statement to them, you can see that immediately this patient has changed addresses, so you don't spend your time and efforts trying to collect from somebody who's no longer at the address that is there. We include coupons and envelopes, so the return envelope is included with each mailed statement, and the statement has a coupon up at the top that fits directly into the return envelope, making it easier and more likely patients are going to do that. These print and mailed statements offer integrated online payments, so the patients can take the statement, go online to the website, myproviderlink.com, and pay that bill without having to come into the office or make a phone call. And ultimately, we also provide reports on all of the statements that are billed out for each of the customers that you have, patients that you have. In addition to the mailed statements, we offer online e-bills as well as text and emailed e-bill notices. These are sent out same day. When you send us a statement file, that evening, the emails and the text messages are going to go out. The sooner your patients receive their bills, the sooner you get paid. We talked about same-day delivery. You have the ability to customize all of those templates to make the look and feel of the notifications be what it is that you're looking for. We offer convenient import tools that will allow you to bring data from whichever software system you're using and import it into BillFlash so that those statements can be processed automatically. This reduces significantly the staff handling time, and it gives you bundled savings and faster payments. If somebody receives a text and they're able to pay it right there on their phone as soon as the text comes through, that's going to be a whole lot quicker than waiting for the mail to send that statement out and then for them to respond to that mailed statement. The integrated pay services make it easy for your patients to pay 24 hours a day, 7 days a week. This is a complete suite of payment solutions. We offer both online self-pay options as well as in-office payments, all under the same pay account. Many of you may be using 2, 3, 4 accounts to collect payments from your patients. BillFlash's payment services are an all-in-one offering that allows you to do both online and in-office payments for under one account, which reduces the number of fees that you're paying in order to collect from your patients. Office pay is what we utilize for our in-office or phone payments. We also provide modern EMV terminals that include Apple Pay and Google Pay options. We offer Card Account Updater, which essentially says if you store a patient's payment on file for an auto payment, a payment plan, or just for called-in payments, if that card expires and a new card is issued by the bank, we're automatically going to update that card so that you don't have any rejections or failed payments that come as a result of that card expiring, because we're automatically updating it. We're offering 24/7 self-pay options, like we said, through myproviderlink.com. And these features all work with stored pay, auto pay, plan pay, and link pay. Those are basically allowing you to store payment methods on file in a completely PCI compliant way. Automatic payments allow patients to say, I want to pay my bill automatically rather than being forced to send in a payment every time it's done. Plan pay gives you an automated way for patients to sign up for split payments. So if they get a bill that's larger than they're able to manage, you can split that up into manageable chunks for them. And if you take a look at the quote on the left-hand side, providers noticed a 60% increase in patient payments within the first 30 days of using BillFlash Pay services. So that if somebody told you that you'd be able to increase your patient payments by 60% within the first month, that's a pretty good case study, and most practices would love to have that kind of increase in revenue. How do the e-bill notices work when combined with the pay services? It completely reduces the number of phone calls that your business or your practice is going to receive. It also has a far simpler payment process for patients to utilize, which results in faster patient payments. If you take a look at the image on the right-hand side of the screen, you'll see what the text-based payment system looks like that comes from the BillFlash system. The far left phone that is displayed there shows the text message that would show up on the patient's phone. You'll see that there is a link that is there. When the patient clicks that link, they're brought to the second phone screen here, where they have the ability to see the amount that they owe. If they'd like to see more details on it, they can sign up or sign into their account to actually view the statement. But if they are just wanting to pay that amount and they know what it's for, they can click the guest pay button there. It's right there on the middle screen. And it takes them to the last screen where they're able to make their payment and they'll receive their receipt. Complete the entire payment process within 3 steps. Those texts are sent out, like I said earlier, the same day that those statement files are uploaded to us, which means that you can significantly increase the speed that those patients that are willing to do this are paying. We also offer something called Gateway Only, which provides you a ton of choice and freedom. This will allow you to keep your existing merchant account provider. So if you have a scenario where you got your merchant service account from your bank as a part of a loan that you took out for your business, for example, and you can't switch to a different offering, we have the ability to provide all of the different services that we've talked about today utilizing your existing merchant service account. This gives you access to those features within BillFlash like stored pay, auto pay, plan pay. Everything that you've seen today is available to you when you utilize our gateway only option. So just because you already have a credit card processing solution does not mean that you couldn't benefit from utilizing BillFlash Pay services, utilizing gateway only. We also offer an integrated collection service, which allows you to really outsource some of the difficult conversations and less fun work for you and your business. Collection services provide a unified workflow for sending recommended collections accounts over while routinely sending the statements. What that means is when you upload your statements to BillFlash, you can say, these are the ones I want to go to statements, and these are the ones that I want to send to collections because of the age of those statements or the balance that is on them. You have full control over how to do that, and it utilizes the same process that you would already be using to send your statements. So you don't have to separate that out and find a way to send certain patients to collections while certain patients are getting their statements sent to them. It is a customized solution that allows you to control how soft or aggressive the recovery efforts are. If you want us to be very soft on your customers and just remind them and function more as an extension of your billing office, we can do that. If you want us to really send in the big guns and let them know that we're going to affect their credit report, we can do that as well. Or if you want something in between those two extremes, we offer a middle tier as well. You can control this when you sign up for the integrated collection services from NextTrust, and it really will function as an extension of your practice. If you want to call those patients with 30-day-old balances to try to collect on those, that's great. Do you also want to call it 60 days? Do you want to call it 90 days? Do you want to pay your staff to do so? Utilizing our integrated collection service, you don't have to do that. We will do it on your behalf. All of the recovered payments that come from this particular service will be received directly into your merchant account using BillFlash Pay services. We are very unique in the market in this regard. Most collection agencies are going to go and aggregate all of the payments that are received from your patients and send you a total amount at the end of the month minus the fees that they're collecting. At NextTrust, we've flipped that completely. We're utilizing your merchant account that is integrated with BillFlash, so you either have to sign up for one of ours or use Gateway Only, but then we're using that account to collect with the integrated collection service, and when that's done, that goes directly into your bank account, and at the end of the month, you receive an invoice for the portion of the payments that were received by that service. Our recovery specialists are certified in all 50 states, and this allows us to do the hard work so that you can focus on the patient care or the other things that your business needs in order to run successfully. So those are the different services that we offer here at NextTrust to solve the 6 different concerns that the patients have. We appreciate the time that you've spent with us here today and hope that this has been beneficial in helping you understand how you might be able to better collect from your patients and bring in a lot more revenue that will help your practice stay financially viable as we move into tough economic times. Thank you for joining us today. If you like what you've seen, you can schedule a demo at billflash.com, or you can call us at the phone number that is listed there above, or you can email us at getpaid@billflash.com. We are on all of the major social media sites, and you can follow us there as well. Thank you for your time today. I hope you have a wonderful rest of your day and rest of your week. And let us know if there's anything that we can do to help your practice be more financially successful. Thank you very much.